we have Mrs. Richardson here to talk about her experience with the liposuction procedure she had done. So what made you want to do it?
I had thought about it for quite some time after having my third child. My last two kids are 19 months apart, and the last one really did me in. I could not get rid of those loose skin between my belly button and bikini line, so I decided to go for it.
So what measures did you take to find your doctor?
I didn't really take any. I found him quite by accident. My youngest son had a little accident involving his older brother. The physician at the ER didn't want to sew him up because he gets keloids when he heals, so he sent us to someone he knew. And he said I would send my own child there, as he put it, so I already felt very at ease. Of course, while I was in the office having my son Peyton stitched up, I had to ask some questions and decided to come back for a consultation.
So before you looked into liposuction, did you talk to anyone or seek other ways to get rid of your unwanted fat?
I dieted, and I was literally stuck at 175 pounds after having Peyton, my last son. And it was a struggle to lose the last 12 to 15, and I still couldn't lose the pouch on my stomach.
Okay, so it makes sense, but were there any things you were nervous about before your procedure?
As a healthcare professional myself, I'm a respiratory therapist, about throwing a fatty embolism, and honestly I think that was the most scary of the things that could go wrong. And the fact that I had 3 boys, and if something were to happen, they would all be devastated.
Okay, and can you describe the day of the surgery for us?
The day of the surgery was pretty smooth, actually. My husband was working day shifts, and my mom had picked me up. She's a nurse, and she took me to the hospital. Honestly, everything went great until I got into the operating room, holding area, and a gentleman came in from anesthesia, as I remember, and gave me some sort of sedation that totally knocked me out. I absolutely hated the feeling of losing control. I've always been awake all the way into the operating room for every other surgery that I've ever had, so that honestly terrified me looking back. He told me it was going to relax me, not put me out.
Yeah, that would freak me out too, but how was your recovery then?
My thighs and the backs of my legs were so tender that I couldn't even sit down on the toilet without wincing. It feels like Mike Tyson had used my saddlebags and speed bags for practice. Not a lot of bruising at all, just very sore. We're close to a week from my lipo. My mom, sister, and even my husband had to bathe me, which was really embarrassing.
Of course, of course. So what advice would you give to people seeking liposuction?
Make sure your doctor has photos. See if you can speak to other patients that have had his service. How long has he practiced and where he did train. These are all good things to know. I feel like I should have done a little more research overall. I feel like he should have been able to make better decisions. He let me make the decisions when he should have used his expertise. For example, take the fat from the saddlebag area, but for goodness sake, leave my natural shape. I've always been a little bit curvy and small-waisted. He took too much fat from my right thigh, and there is now an indentation. Maybe not noticeable to everyone else, but I'm aware of it. He should have used his judgment. After all, he's a surgeon.
I absolutely agree, and I hope all the viewers can understand that there's a downside to liposuction, and there are so many risks involved, and I hope people take other measures to prevent this procedure before going in.
I totally agree.
Thank you for